Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, November 23rd, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto City Councillor and Chair of the Board of Health, Councillor Joe Cressy. Mayor Tory.
Well, Brad, thank you and good afternoon. Earlier today, Toronto and Peel region moved into a 28-day lockdown. I'm determined to make sure we, like many other cities across Canada, get through this period, stop the spread of COVID-19, which is the main objective here in our city, and get the numbers which continue to be extremely troubling right now, to get those numbers going in the right direction. We've done it before, earlier this year, and I know the vast majority of Toronto residents are committed to doing the right thing right now so that we can save lives and help keep people healthy. We had the discipline in the spring, and there's no reason why we can't have the same discipline now, starting with staying home. Staying home wherever and whenever possible and reducing contact with any people you don't live with is essential. We know from Toronto Public Health that parts of our city are suffering from COVID-19 more than others. We can't stop the spread of COVID-19 in some parts of our city while it rages like wildfire in other parts of the city. And we owe it to the most vulnerable to make sure that extra measures are provided, extra supports are provided in their fight against COVID-19. We have to fight this virus everywhere, and we have to stop it everywhere. Today, I am announcing that we, the City of Toronto, are expanding our targeted COVID response in areas of our city where the case numbers are much higher, including the northwest part of the city and including northeast Scarborough. While our health officials have been clear that city-wide restrictions are necessary to reduce the number of people we all come into contact with and reduce the likelihood of COVID-19 spreading, we know this lockdown must be implemented alongside enhanced supports to protect frontline workers and essential workers, along with proactively targeted and specific support to the areas and to the people who have been the hardest hit. The pandemic has exacerbated long-standing systemic health inequities related to poverty, to racism, and to inequality. We know from Toronto Public Health that COVID-19 is spreading with extreme and disproportionate impact on Torontonians who are Indigenous, Black, or racialized, who are precariously employed, who live on a low income, who may often be living in multi-generational housing, or who experience challenges taking time from work when ill, or taking that time to isolate from others. As we've discussed before, data demonstrates that COVID-19 hotspot neighborhoods are experiencing significantly higher rates of COVID-19 transmission, lower testing rates, and higher positive rates for the virus compared to other neighborhoods in Toronto. We are ramping up our TO supports plan to fix this. In partnership with 11 highly trusted, community-based partners, the City is immediately launching an urgent set of initiatives in targeted neighborhoods to increase supports and testing for residents in COVID-19 hotspots. This is an all-hands-on-deck effort. Every part of the City government that we can mobilize is involved. These initiatives include a broader and more inclusive sharing of public health information, improving access to COVID-19 testing, and providing critical supports to individuals who test positively and to their families. To address lower testing rates, testing hesitancy, and improving access to testing in hotspot neighborhoods, we're looking at expanding the number of provincial testing sites using even more city facilities and using buses or similar vehicles for more mobile testing, as well as to provide more transportation to testing sites and extending testing site hours. Yes, the City's ability to fully implement these initiatives is dependent on support and collaboration with provincial agencies, but we have been good partners with each other so far, and we are confident this cooperation will continue, as it must. We're also looking to intensify community outreach and engagement, including targeting outreach, case management, and providing support to help residents who face multiple barriers, such as food support, income services, and access to mental health support, to name a few. Providing relevant public education to residents and to employers, targeting food programs and mental health supports to those who are most in need, and for those who test positive and are unable to work due to mandatory isolation, we're looking to see measures implemented which will address the threat of eviction and improve access to emergency assistance. The City has been clear that the residential eviction ban in place earlier this year should continue, and we repeat that request to the provincial government again today. Beyond continuing our support as a city for residential eviction protection, we know that income supports and newcomer COVID-19 supports will help us to stop the spread of COVID-19. Right now, people are waking up. People in the City of Toronto are waking up with COVID-19 symptoms, going to work, and giving the virus to their co-workers. Why? Because they fear losing their jobs and or their paycheck, and they feel compelled to continue working without getting tested so they can put food on the table, and that is, they need to continue to work so that they can put food on the table and get that paycheck. We have to help them so that they can do the right thing, namely to get tested without fear of losing their job or their paycheck. All of the mayors and chairs from the entire Greater Toronto and Hamilton region met today, and they agreed on the paramount importance of ensuring that every resident of this region can get tested with confidence, including with the confidence that a positive test result will not result in them losing their job or their paycheck if they test positive and have to isolate for 14 days. Whatever the arrangements presently in place, they are either not adequate or not adequately understood, and this must be fixed. The federal and provincial governments have passed legislation to help people and businesses, but we need to make sure that people know how to access that support, and if more needs to be done, we need to work together to do it. I've had good discussions with ministers from both governments about this over the weekend and today, and I know they are committed to helping, and that includes helping with the new supports that I've outlined today. I will continue to urge employers to do the right thing to protect their employees and their city by making sure their employees know that they have the support of their employer and their governments and won't lose their job or their paycheck if they test positive for COVID-19 and have to isolate. It makes sense from a health perspective, and it makes sense from a business perspective to make sure that sick people don't feel they have to go to work. We're asking for support for these new initiatives, and just like with many other new measures, including the isolation site we opened earlier, I'm confident that support will come to help us all address this urgent situation. The required support was a key focus of my weekend discussions with the other governments, which have been good partners to date. And while we work on that support from the province and from the Government of Canada, City staff will begin implementing parts of the plan this week, including some of the education and outreach initiatives, food access, mental health support, engagement with community partners on their role in this plan, and the purchase of masks for distribution. I want to thank our City staff for developing this updated and enhanced plan quickly to help make sure that all of our neighbourhoods in all parts of our city can get back on track. All of this work is important, but we can only be successful if we make sure that there aren't other areas that are left unchecked where the virus can spread. An example of that is Black Friday coming up at the end of this week. I urge all retailers who are still open to avoid in-person Black Friday sales. You are open by order of the province, so residents can buy essentials. You are not open to cash in on Black Friday and in so doing create crowd scenes. We are in the midst of a pandemic and a lockdown. Now is not the time for pandemonium Black Friday shopping scenes. Black Friday sales online are fine, but please do not create a situation where people will gather in large and unnecessary and unhelpful numbers. And to Black Friday shoppers, please stay home and shop online, or use the curbside pickup option for some of these smaller independent retailers. Please give every consideration that you possibly can to supporting smaller, independent, local retailers, many of whom have an online presence and almost all of whom will have a curbside pickup permitted under the provincial lockdown measures. No deal, no TV, no clothing item, no video game is worth someone else getting or taking a risk on someone else getting COVID-19. During this lockdown, that remains our message to everyone, the simplest part of the message, every day, every hour of every day for the next 28 days. please stay home whenever you possibly can. On that note, I'd like to invite Dr. de Villa to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 331 new cases of COVID-19. There are 167 people in hospital with COVID-19 and 41 in ICU. Since I updated you last Wednesday, we have reported a total of 2,177 cases of COVID-19 in our city. As Toronto is now officially under the restrictions of the province's lockdown category, today I revoked the orders I issued last week to keep in effect certain closures on the basis that the force of the province's authority supersedes mine. As I said in my remarks last Friday, since October the 1st, we have reported 45% of all cases of COVID-19 recorded during the entire pandemic. Considering such a significant level of spread in a matter of weeks, considering almost 2,200 cases in just the last 5 days, the need for the restrictions enacted by the province is not in question, even though it comes with the additional cost of hardships for people as a result. Regrettably, the threat of COVID-19 is so widespread that the most difficult choice had to be made. Even so, it is my hope if we work together, we can minimize the impact and move on from these restrictions after 28 days. The extent to which we may be able to relies heavily on the choices we make as individuals during these 28 days. First and foremost, if we're strict about keeping apart, we immediately gain ground against COVID-19's ability to spread. So whenever you can, in the next 28 days, choose to limit contact. Make that choice for your own protection in the short term and for the benefit of everybody in the long term. And do bear in mind that many people can't make that choice, as much as they probably want to, usually because of their jobs. And we need these people. We need them at the grocery store, and we need them at the pharmacy. We need them staffing our schools, and we need them more and more providing care in our hospitals. Wherever you see them at work, they're there because that's where we need them to be. So we owe it to them, those of us who can choose to keep apart more than others. We owe it to them to choose wisely and in ways that limit the risk for those who don't have the choice to keep apart and who may be at even greater risk of getting sick because of it. This is truer for some communities in Toronto than others, often on account of race or income or both, where our data finds the risk of infection can be double or more the risk for other residents in the city. The ability to keep apart would be made easier for many people during this pandemic, with supports that make it possible to do so. When people are able to stay home for a while when sick, or stay apart for a time when we're all at risk, the better it is for all of us. This is why I agree that supports should be implemented for people who don't have the same choices and alternatives that many of us do. It's the simple formula of managing infection spread of the scale we face with COVID-19. The less opportunity people have to interact, the greater the likelihood we'll see less infection. At this point, I'm still very worried about where we are, where we're going, and what happens as we get there. I urge you to act with the care and caution that we all showed last spring. As I've said many times, with each choice we are able to make, we can lessen the likelihood of worse infection rates and soften the blow of what is yet to come. I believe we're closer today to living the kind of life we remember before there was a COVID-19. But that moment is on the horizon, not just around the corner. And so I ask you to please keep focused while we get there. I'll now turn it over to Chief Pegg to deliver his remarks.
Excuse me. Thank you, Dr. de Villa, and good afternoon. Effective this morning at 12:01 a.m., the City of Toronto has entered the grey lockdown category of the Province of Ontario's COVID-19 response framework in an effort to slow the spread of COVID-19. Since the announcement of these changes on Friday afternoon, our staff have been working around the clock to assess and modify city service delivery models where necessary. It is important to note that the City remains prepared to respond to emergencies throughout the lockdown period. Emergency response service levels by Toronto Police, Fire Services, and Paramedic Services is not impacted and will continue without interruption. Likewise, we will continue to provide the essential and critical services that our residents require, as we have throughout the COVID-19 pandemic. The City's coordinated enforcement teams were active all weekend, both proactively inspecting and enforcing the provincial regulations and orders, as well as responding to complaints. Over the course of the weekend, our enforcement teams inspected 44 restaurants and bars. 30 were found to be operating in compliance with the regulations and orders. 14 were found to be in violation, resulting in 5 charges being laid and 9 warning letters being issued. We inspected 23 hookah lounges and 65 flea market vendors, resulting in 4 warning letters being issued. Further, we inspected 113 personal service businesses, entertainment establishments, and gyms. I'm pleased to advise that each of these 113 businesses were found to be operating in compliance with the regulations and orders. We continued to actively patrol our beaches and parks over the weekend, resulting in 33 charges being laid under the Trespass to Property Act for illegal activity on Toronto beaches and parks. We extinguished 35 bonfires on Toronto beaches this weekend. We responded to 106 complaints related to gatherings on private property over the course of the weekend. 47 of these were received via complaints submitted to 311, and the additional 59 were submitted directly to Toronto Police. 39 charges were laid as a result of these complaints. I will provide you with a few examples of the situations being encountered by our enforcement teams. On Friday night, officers responded to a large gathering inside a storage unit on Trethewey Drive near Black Creek Drive. As a result of the response to and investigation of this incident, 1 charge was laid under the Reopening Ontario Act. Also on Friday night, officers responded to a large gathering on Lawrence Avenue West in the area of Allen Road. As a result of the response to and investigation of this incident, 15 charges were laid under the Reopening Ontario Act. Finally, officers responded to a large gathering on Saturday night in the Keele and Eglinton area. As a result of the response to and investigation of this incident, 1 charge was laid under the Reopening Ontario Act. In closing, I'm pleased to report that the work of our immunization task force is continuing as a top priority for our city team. Our immunization task force has been operating for a number of weeks now, as we work proactively to ensure that we are ready. We are continuing to work hard to ensure that we have comprehensive plans in place, such that we are ready to go once the governments of Canada and Ontario make vaccines available for distribution. I encourage everyone to continue to follow the advice of Toronto Public Health and maintain compliance with the important public health measures as we do all we can to slow the spread of COVID-19 in our city. For details on the impacts to city services in Toronto that came into effect at 12:01 this morning, please access toronto.ca/COVID-19 for the most accurate and up-to-date information. Thank you. I now invite Councillor Cressy to provide his remarks.
Well, thank you, Chief Pegg, Mayor Tory, and Dr. de Villa. To beat COVID, we must protect those hardest hit by the virus. That's what it means to be all in this together. Today, we're providing an update on immediate measures the city is launching in targeted hard-hit neighborhoods, especially in the Northeast and the Northwest. And we're announcing additional policy changes we're working on with our provincial and federal partners. First, testing. We're taking further steps to support the provincial testing system in the Northwest and the Northeast. Building on work already underway, we're making additional city facilities available to support testing. We're retrofitting buses to serve as mobile testing sites that can be brought to people where they live and where they work. We're also providing our fleet of vehicles to transport people to help them access testing. Second, addressing testing hesitancy. For many hard-hit communities, one of the biggest issues we're finding is that people are hesitant to get a test. And I have to tell you, it's understandable. For many residents, they're worried that a positive test result will mean staying home, which can mean lost income. It's an impossible choice. As a frontline worker, either go to work and risk contracting or spreading COVID, or get tested, stay home, and risk losing the money you need to pay your rent or feed your family. To help address testing hesitancy, we're rolling out an enhanced outreach program in hard-hit neighborhoods, operated by trusted local community organizations. It's boots on the ground, or in this case, trusted local community outreach workers on the ground. They're going to be out in communities in the Northwest and the Northeast to support residents to get tested, to refer them and help them gain access to our voluntary isolation facility, and to help people get the wraparound health and income supports that they need. The third pillar here is income supports, eviction prevention, and sick days. If you can't afford to be away from work, you can't isolate. That's why paid sick leave is so important. If you're worried that a positive test result will result in lost income and the inability to pay your rent, you're less likely to get tested. That's why an eviction moratorium is so important. And while lockdown measures mean working from home for some, that's not the case for many, especially frontline workers. In the first wave, we saw that lockdown measures resulted in reduced household income. That's why enhanced emergency income supports are so important. Listen, I know this is a challenging time for everyone, especially those in our city who were already struggling before this pandemic. In the first wave, our collective efforts and sacrifice worked. Together, we flattened the curve, and we saved lives. But it came with a heavy cost, and too many Torontonians bore the brunt of it. We simply cannot, we must not, let that happen. That's why these enhanced measures and our city's Equity Action Plan is so important. In Toronto, we talk about being all in this together. It's not a slogan, it is our commitment, and in order to beat COVID, we must truly be all in this together. I'll now turn the floor back over to Brad Ross for questions.
Thank you, Councillor. Before we go to questions, there are a number of staff on the line for any detailed questions you may have, including staff from social development, from shelters, from bylaw enforcement, children's services, parks, Toronto Police, long-term care, and transportation. First question is to Brian Passafume from the Toronto Sun. Reminder to please unmute yourselves. We cannot do that on this end. Brian, go ahead.
Good afternoon, everybody. Hope you had a great weekend. Question, with the province putting Toronto under another lockdown, with already struggling businesses having to rely on curbside pickup to keep from going bankrupt, can someone explain the decision-making process behind reinstating rush hour parking enforcement in the city?
Well, I'll just say it's part of a broader consideration that is being given to the issue. The police had indicated their intention to restore rush hour traffic enforcement in terms of people parking in lanes of traffic during rush hour because the traffic levels through the month of November were actually coming back up much closer to normal. But what we have now asked them and the Transportation Services Department for the city to undertake is an examination of what we need to do in order to accommodate the curbside pickup option, as we did in the spring. And so we haven't got the results of that request that I made as yet, but I expect we'll have it in the next day or two. I don't think it'll result in a change in the main arteries having rush hour traffic enforcement continued, because I think that in many cases that's just not something that is an option to have curbside pickup going on during rush hour. But I did ask that the other hours of the day be examined with respect to having a degree of flexibility, and so we'll see what comes back from that inquiry in the next couple of days, both from transportation and from the police.
Okay, that's my only question. Thanks.
Okay, Brian, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Good afternoon. I was wondering, aside from anecdotal evidence of people skipping tests or things in that nature who are low income, do you have any hard data on how many people this is actually affecting?
So, Matt, what we do have, as you know, is the data that we have collected through our case management process. And we do collect socio-demographic data that show that there are certain segments of our community that have suffered more in respect of COVID-19 infections than others. I mentioned in my remarks a little bit about racialized groups and how much more COVID-19 infection they've suffered than non-racialized groups. The same can be said for lower income households as well. And we know as well from our data, as you look on our website and see the data that we have available for the public to view, that there are neighborhoods as well that have suffered more by way of COVID-19 infection. And we can also see through that website that there are certain segments of our population, certain neighborhoods throughout the city, where there just has not been as much testing uptake as we would like to see. So hence, supports to facilitate the ability of people to understand the benefits of testing, and supports as well to ensure that they're able to partake of those protective measures for themselves and for our community as a whole.
Can I just comment on that? Because I think quite often, and I've had this discussion with other journalists before, the notion of anecdotal evidence is dismissed. You start with a foundation of fact, which says, as Dr. de Villa said, we have in those neighborhoods the lowest levels of testing in many cases and the highest levels of positivity. And then you build on that the anecdotal evidence, which tells you, because I went up to some of those areas to find out for myself by talking to people why they were not getting tested. And they would point out two things that this new support program is going to address. Number one, the accessibility of testing itself. A lot of those people don't have a car, don't find it easy to get to the places where the testing is presently undertaken, and therefore we're going to try and make it more local or even take them to the tests through transportation. And the second is a real fear that people do articulate with respect to losing their paycheck. And so two of the things that we're talking about today, the one being accessibility of testing, the other being measures to make sure people have no fear that they're going to lose their paycheck, are answers to what is a statistical foundation that says there's a problem in those areas, not just with high case counts, and not just with high positivity rates, but with low testing rates.
Okay, and sorry, just to clarify, I wasn't discounting anecdotal evidence. I was just wanting to know if there were any other hard figures. As for my follow-up, Mayor Tory, you were saying that it's critical to get other levels of government to come to the table with these supports for low-income individuals. When we're in a race against time here to try to avoid maybe an extension to this lockdown, what is an appropriate amount of time for them to actually come through with this funding?
Well, I should start by saying, and others may wish to follow up on this, I should start by saying that in both cases, the other governments had offered to help us in efforts that we were going to make, extraordinary efforts, I'll call them, to address the hotspots, the places where vulnerable people were much more subject to being victimized by this virus. I will also tell you that in my conversations with the Deputy Premier and the Deputy Prime Minister in the last 24 hours, that we indicated that we need their support to get this done. And I think in light of the fact that both governments had indicated that they would try to be supportive of efforts that we would make in this regard, they were just waiting for us to come up with the plan. And we've submitted the plan in its fullest detail that we have it to those two governments, and I would hope that they can make a decision fairly quickly. I've also sent it to other cities right across the country because I think other cities should see what we're doing, not that it's all right or that it's perfect, but I think it's initiatives that they are experiencing some of the same kinds of challenges, and I think the governments at the other levels will be very interested in doing this, both because it's the right thing to do as a matter of humanity and equity, but also because in the end, it is going to save far worse damage, including financial damage being done, because we're going to, hopefully help to nip the areas of worst experience in the bud.
Okay, thank you. We'll go next to Holly Mackenzie Sutter from the Canadian Press. Go ahead, Holly.
Hi, just wondering about the kind of encouragement that people do curbside pickup and order online, but for people that don't have phones or internet, it's not really an option. So we're wondering, is there a sense that these restrictions, especially on businesses, are more punitive to the most economically disadvantaged people in the community?
Well, I can start is, as part of the city's comprehensive response, one piece is on access to digital devices and Wi-Fi. We know that for many Torontonians, especially low-income Torontonians, access to digital devices right now is not only necessary in able to access essential products and services, but also to access mental health resources and supports, to access other social service supports they may need. And so it's on that basis that the city's Wi-Fi and free Wi-Fi program has been rolled out not just in public libraries, but in targeted buildings, in low-income buildings and public housing buildings throughout the city to support just that.
I will only add to that, the digital divide is an issue that's going to go far beyond this pandemic in terms of being something that we have to address in order to give all Torontonians equal access to opportunity. Equal access to education and information. Think of the even more profound implications then beyond curbside shopping and online shopping that I would say exist with respect to some of the kids who are trying to do their learning online. Where they've made that choice and where they don't have proper access to the internet through a device or just even the internet service itself. I'm told that unless you have a certain quality of internet, you really can't have that experience properly. And so that's got to be of real concern to us. And I think that, that's something we're going to have to continue to work on with the other governments as we emerge out of the pandemic, because it's an issue that goes far beyond the short-term shopping opportunities for people.
Follow-up, Holly? No? No follow-up, Holly? Okay.
Yeah, I do have.
Oh, you do? Okay,
I do have
sorry,
one more
go ahead.
question. Yep. Sorry, just wondering about the sick leave issue and people not wanting to get tested. I guess I'm just wondering what's being considered as a response to that problem, and when some measures might actually come through.
Can I start on that, and others may wish to add? I will say one of the biggest problems at the moment, even with me as someone who reads a lot about these kinds of things and tries to read the provisions of all these different programs, is that there are programs that exist at the federal level, but it's not clear as to whether people that are in this circumstance qualify for those programs, and it certainly isn't clear to them in many cases as to how they'd go about applying for those programs. So I think that is problem number one, to see how many people you could get a degree of assurance that they won't lose their paycheck because of the existence of a benefit. And of course, in many cases, those people would get their paycheck at the end of a week or a 2-week period, and oftentimes even the notion of filling out an application as expeditiously as government may deal with them, and they've been doing not a bad job in that regard during this pandemic, is something that causes them a huge cash flow problem in terms of feeding their families. And then I think the second challenge we face is one that takes people who don't qualify for those programs, even when it's made clear, and finding out what we do to help them. And I think that will result or require some policy changes from the other governments in order to make sure, as I said earlier, there is no one who can't go and get tested confidently, knowing they will not lose their job or their paycheck.
Okay, thank you. We'll go. Sorry, did you want to add something, Councillor?
Well, I think I would expand on that, which is, as the mayor mentioned, we've seen in many communities, especially in some of the hard-hit neighborhoods, that many members of the community aren't aware of the services that are available. And so part of the enhanced community outreach programs that we're rolling out here, in partnership with trusted local community organizations, is to put local outreach workers on the ground in the buildings where people live, talking to them in the language they speak to ensure that they know not only how to get tested, but how to access the supports that are available. That can be income supports, that are already available from the province and federal governments. But it can also be isolation supports. We have a voluntary isolation center, the first of its kind, open in our city, and we need to make sure that people are aware of it and comfortable using it. And so that's the outreach component that we've heard is so critical in partnership with community organizations. And as the mayor mentioned, we know that in partnership with our provincial and federal counterparts, some of these income and sick leave supports and provisions can also be strengthened, especially for people who currently don't qualify. And that's where the mayor's advocacy and our city's work is happening right now with our counterparts to ensure that that's bolstered and addressed.
Okay, thank you. We'll go next to Francine Copen from the Toronto Star. Go ahead, Francine.
Yes, good afternoon. Can you hear me?
Yes, we can. Go ahead.
Great. So I want to make sure I'm understanding this right. In terms of people who are afraid to get tested because they're afraid of a positive result, which will result in them losing their paycheck, the city isn't offering them any financial support. They're offering them support in accessing funds that are being made available by other levels of government, and they're also offering them support by agreeing to lobby other levels of government. Does that accurately sum it up?
Again, I'll start by saying I think the short answer to that question is yes. We know there's a problem both with respect to testing and what the consequences of testing are and the whole experience where we can use trusted local people from local community organizations to explain that. But I think part of the explanation has to involve us being able to give some degree of assurance to people who are concerned about their paychecks that there either is a federal program or a provincial program that's available and we can help you to apply so that you can have that dealt with expeditiously. And we need to lobby for policy changes to make sure that those programs are inclusive of everybody who might be concerned about losing their paycheck, so that all of those people, without exception, can go and get tested with confidence and will not go to work with a symptom and do that out of fear of losing that paycheck. Joe?
No, I think, as the mayor said, we know in certain neighborhoods that testing rates are low and positive rates are high. And we see that in the data. We also know in the data that low-income Torontonians have been disproportionately affected by COVID, and we know that low-income Torontonians have been disproportionately affected and lost income during lockdowns. And you take all of that data together, combined with the experience we're hearing on the ground from community organizations, and you realize that a bolstered outreach program is critical to support residents to get tested, to help ensure that they can isolate safely and refer them to our facilities, and to help them access the supports that are available. And where they're not available currently, we're working with the provincial and federal governments to ensure they're made available.
I have a second question.
Go ahead, Francine.
Dr. de Villa. Is it still possible that we'll be able to celebrate Christmas with family members from outside our homes?
Sorry, Francine.
Just repeat that, Francine. Something. You're just breaking up a bit there.
Yes, I'm very sorry. Is it possible that we will still be able to celebrate Christmas with family members from outside our home?
So, Francine, I think that we have to see what the next 28 days holds for us. And I think what the next 28 days holds for us rests to a great extent in our own hands. We do need people to make good choices around limiting their interactions with others, so that at some point in the future we can once again interact with people beyond those in our household. But for now, I think the focus is on doing the right thing at this point in time, which is limiting interactions, staying home as much as possible for those for whom that is a possibility and where that choice can be made, so that those who can't make that choice given the nature of their work or given the nature of their circumstances, can continue to do necessary work to best serve our community. And I think that's how we move together and have progress together as a community in the circumstances that we're in right now.
Okay, thank you. We'll go next to Jenny Ewan from the Toronto Sun. Go ahead, Jenny.
Hi there. This one is for Mayor Tory or Dr. de Villa, if you want to chime in. We were given a photo of the city limit sign. So it says, welcome to Toronto, and then underneath there's another sign that says Ontario's capital. And somebody has actually added another sign underneath that reads, in overdose deaths. So Mayor Tory, I just want to get your reaction to the sign and the spotlight on Toronto's opioid crisis. And we've also seen a number of fentanyl-related deaths in Cabbagetown recently. So I'm wondering if either of you are concerned about another spike in the second lockdown.
I have repeatedly expressed my deep concern, as I do again today, about this. I think it has been something that the spotlight has not been on the way it should in the context of the tragic and preventable loss of life we've seen on a scale that is beyond almost anything else except perhaps COVID-19 itself in terms of taking lives in the city. And I think we have a significant harm reduction program that is being implemented by Toronto Public Health and by the city government as a whole, but there's more that needs to be done, and we need more support, especially through the provincial healthcare system. I've repeatedly said that I think both the supports for those with mental illness and those with substance use issues in their lives is wholly inadequate, and that we need to be, redoubling our efforts in that regard in order to stop this kind of thing from happening. So I think, while this isn't necessarily the single best way to draw attention to this, it is something that's got us talking about it. And I think the more we talk about it, the more we advocate for greater action on the part of all governments and working with the nonprofit partners, the better.
So if I can just follow that up, I would agree with the mayor that this is an issue that absolutely demands our attention. And that's why, my team and I brought a report to the Board of Health in respect of what kinds of steps are needed. And we certainly heard a great deal of support from our Board of Health around moving forward on recommendations and evidence-informed actions to address that crisis in health in our city. There's no question COVID-19 has been an almost all-consuming challenge for us to deal with, but that doesn't mean that we're not paying attention to other challenges, the opioid overdose crisis in our city being a key one amongst them. We are very cognizant of the fact that COVID-19 has exacerbated many of the challenges and the drivers moving forward and that are propelling opioid overdose deaths in our city. So we continue to advance our overdose action plan, and we are certainly advocating at the other levels of government, the provincial level of government, the federal government, to do more, to work with us to do more to address that very, very important health issue.
Great. Thank you very much.
For your information, those signs have been addressed by staff and have been corrected, so thank you. We'll go last question. Final question is to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi, all. First question for whoever wants to handle it, and that's York Region politicians asked to not be locked down, and the provincial government concurred. We have seen Torontonians get infected in York, primarily at weddings, and then come home and infect other people here. And York Region COVID levels today are on the rise, or seem to be. How concerned are you, or are you concerned that one part of the GTA that is a hotspot is not locked down and that there's movement back and forth?
Well, perhaps I can start off with that, David. I would suggest that, of course, we're concerned when we see levels of COVID-19 activity increase in any part, certainly in Toronto for sure, but we would, of course, be concerned about increases in activity in the jurisdictions around us. And I think it speaks again to that very, very important choice that sits in front of all of us, right? For those of us who actually have that opportunity to make that choice, to limit our interactions as much as possible with those with whom we don't live, right? This is what we can all do to contribute. if we don't have to do something, and if we don't have to do something in person, we are really asking everyone, whether you're a resident of Toronto, resident of York, it doesn't matter. In this province, there's a lot of mobility, and we are all connected in many, many ways, shapes, and forms. So it does come down to each and every one of us making good choices, staying focused on the fact that we can get there. We've done this before. We have shown that we can limit our interactions and reduce virus spread. And I would just ask everybody, residents of Toronto or otherwise, to continue to try to make those good choices, to limit their interactions to the greatest extent possible, to stay home as much as possible so we can get beyond this chapter and put COVID-19 behind us.
Can I just add to that? I thought it was interesting and telling in a positive way that the mayors and chairs today, including those that are not subject to the lockdown, specifically agreed unanimously to discourage people from interregional travel, because some of them could have stood to benefit from that in the context of their merchants being able to make sales to people from Toronto who were in a lockdown, but they understood it's better to follow the advice, which is to stay home. And even if you decide as a small exception to staying home to do the curbside pickup, where you've made the purchase online and go to pick it up, you're staying in your own car, you're shopping local and supporting people who are in our own local city of Toronto, and you're not coming into contact with other people. And so, but the mayors and chairs were unanimous in saying that people should avoid this interregional travel, and I think they were unanimous as well in saying that the most fundamental piece of advice we have offered, all of us together, collectively, repeatedly, is please stay home. Please stay home. It doesn't matter what the rules say or what the orange and purple and stage 2 and stage 4. Stay home. I mean, that's very simple advice, and if everybody just followed it, we'd be way better off.
Thank you. And just following on that exact topic, last time there was a lockdown and it did flatten the curve, people didn't know much about the virus. There was a lot of fear. You know, people didn't know if they could get it off surfaces, and maybe people reacted in that way by not socializing. But then we had the summer where people started mingling again. My question is, what if we can't get the toothpaste back in the tube? What if socializing continues? Do you have any other tool in your toolbox? Because otherwise it sounds like all this economic pain will not have done the trick.
Well, you know, I think we have seen from the experiences of other jurisdictions that are a little bit ahead of us that there is the possibility that this is doable, that through the combination of efforts, you've got government coming forward with policies and the people that need to cooperate as much as possible where they actually have the options to choose. And we know that the greatest strength in terms of addressing COVID-19 spread and mitigating its impact comes from the collaboration between these two areas, the government and the people. So I would just ask everyone, as the mayor said, that whether you live in Toronto or in another jurisdiction that's farther afield, it's a simple piece of advice. And for those of us who can actually, do it, we would encourage you and ask you and urge you to do that. Please stay home as much as possible. Really think about whether the activity that you're thinking about is something that you really need to do or something that you just want to do. And if it's a want, just leave it aside for now. If it's a need, try to find ways to do it that don't involve leaving your home or that are more virtual or remote. Because that's what we can all do together to reduce virus spread and to get us, to the next chapter, to life beyond COVID-19.
And David, if I could just add that in addition to flattening the curve, which we successfully did in the spring, and we will do again here in the second wave, we've learned that comes with costs for people. And that's why today we're talking about enhanced supports for those who are most vulnerable and most disproportionately affected by these lockdown measures. But it also means supporting people who are isolating at home, who are following the rules. And that's why things like enhanced mental health services, virtual programming opportunities that have already been rolled out, and enhanced outdoor programming, these are the type of enhanced initiatives that our government's putting forward to ensure that people not only stay home, but can live the best they can economically socially and from a health perspective as well.
All right, thank you for joining us. That concludes today's briefing. We'll return here on Wednesday. Please stay well.